At Kintampo Health Research Center, we conduct vector surveillance and other vector activities which involve the use of a CDC light trap to trap mosquitoes at the community level. We also do paratroom spray collections to be able to understand the resting behavior of mosquitoes, and we do human landing collections as and when the study demands. We do vector surveillance for us to be able to understand the transmission dynamics of malaria species, vector species. We also want to understand the species distribution across the study area. This will be able to help us to go and do targeted intervention for the study area. We will also want to collect data to also inform policy. We have trained field supervisors who have been trained in the collection of these samples, and in each week what they do is to first trap. They come and then charge their batteries, and then we have a set of traps. We use BG traps, which we use to trap for Aedes mosquito, and the CDC light trap, which is used to collect generally all vectors. That is a Anopheles mosquito. It collects both Anopheles mosquito and the Culex and other non-target organisms, maybe vectors. So we trap them from the field, and from the field samples are transported to the center where sorting is done, and after sorting we do species identification using morphological keys in the microscope, and some of these samples are now ID'd using unique identifiers and then stored for later use. So later what we do is that we sort some of these samples out, and then we do species identification using molecular methods, and then we run immunological assays to look at the sporozoid rates within the samples that have been collected. So for this trapping, basically we know Anopheles mosquitoes, that is our interest. They are done to dusk mosquitoes, so mostly field supervisors go in the evening and we set traps in the night. They wake up very early because some of these communities are very far, so they leave by 5 a.m. to reach the communities and then pick these traps and come back. So we do morphological identification where we do morphometric generally to the genus level, and at the species level we do molecular assays to be able to identify, to know from the species complex the exact species that we have in the study area. And with this we have been doing it over the period to understand the dynamics, and in case there is the presence of new species in the study area. So for us to determine the mosquitoes resistant to insecticides, we do something we call the bioassays. And at the Kintampo Health Research Center over the years we have done susceptibility testing using WHO standard tube testing, where we test with various classes of insecticides that have been approved by WHO. And so during testing what we do is that we raise colonies, that is the Kisumu strains, which serve as control, and we collect mosquito larvae from the community, which we bring to the lab and rear them to adults, and use the 2 to 5 day old mosquitoes to subject them to these insecticide impregnated sheets to see the resistance status of these. After the knockdown resistance are collected, those that are not able to die after the 24 hours, depending on the type of insecticide, we have standard protocols that are used, and the resistant strains are later removed and used to do other testings to understand the mechanism involved in the resistance of these mosquitoes. KHRC have been involved in training health workers in some of these vector surveillance activities and larval source management. We've also contributed in the development of the national entomological policy document or guideline for the country, and other entomological data review at the national level. We've also carried out entomological data which we have published, and it has helped to inform policy. As we conduct vector surveillance, we continue to educate community members on the role they play in reducing mosquito breeding size and the proper use of nets to help reduce malaria incidents in the community. Well, Malaria Day 2025 calls for us to reinvest, reimagine, and reignite. Vector surveillance is key, as surveillance data helps us to have a real-time data on the changing dynamics of vector distribution, abundance, and other entomological indices, which can help us to help in the control of malaria. So, as we celebrate Malaria Day, we want to say ending malaria is possible if we all play our part. So please let us continue to use our insecticide-treated nets. Let us clear our homes and keep the place tidy, as sanitation is key to vector control. Let us try to educate people around us, and let us continue to do the good work that we are doing.